open conversations, Reiki and Pranic healing. Today's topic of Reiki and Pranic healing will be of interest to those who are interested in holistic healing. Reiki and Pranic healing both are forms of energy healing. From strictly allopathy point of view, there is no significance to any form of energy healing because it is empirically not investigated. But those who believe in holistic healing, they believe that there are 5 bodies: the physical body, which we can see, and other 5 bodies, other 4 bodies which we cannot see. The energy body, the emotional body, the thought body, and if you believe, then 2 more bodies, the karmic body and the body of pure consciousness. Body of pure consciousness does not require any healing, but healing is required from holistic healing standpoint in other bodies. So things can go wrong in the physical body, for which you have allopathy, Ayurveda, homeopathy. Things can go wrong in the energy body, for which you have Reiki, pranic healing, acupressure, acupuncture, Tai Chi. Things can go wrong in the emotional body, for which you have psychotherapy, homeopathy. Some forms of pranic healing also. Things can go wrong in the thought body, for which you have cognitively oriented psychotherapies. Some forms of pranic healing also can help. And things can be wrong in the karmic body, for which you have spiritual practices, meditative practices, service to others, and some forms of pranic healing, especially the arhatic forms of arhatic and later part of pranic healing. Energy healing practices are usually seen as complementing therapies, not as a substitute for mainstream medical approaches like allopathy, homeopathy, or Ayurveda. WHO, I believe, and I might stand to be corrected, I believe WHO also recognizes pranic healing as a complementing modality of healing. One important element to be said, and that is, don't try anything on yourself without expert guidance from your doctor or a licensed medical practitioner. Second, before we go into the discussion proper, let us set the stage in order. When we talk of energy healing, we talk of various practices, various approaches within the broad area of energy healing. So Reiki is one approach. Pranic healing is second approach. Acupressure, third approach. Acupuncture, fourth approach. Crystal healing, fifth approach. Tai Chi, sixth approach. Qigong, seventh approach, and so on. All these are various ways of practicing pranic, practicing energy healing. So energy healing is a wide area in which all these paths, all these schools exist. Reiki and pranic are two approaches within that broad domain of energy healing. Today, what we'll do is we'll compare and contrast Reiki and pranic healing. We will not go into other forms of energy healing like acupressure, acupuncture, Tai Chi, Qigong, crystal healing, and so on. We'll only focus on two forms of energy healing, Reiki and pranic healing, and do a compare and contrast of the two. One generic disclaimer before we get into the discussion. When we use the word energy healing, we use it in an intuitive, experimental, and approximate sense. We don't use it in a very empirical and specific sense. What do I mean by this? When I am practicing Reiki, and I have learned both Reiki and pranic healing, and I practice both on myself, so I know from first-hand experience the compare and contrast part of the two. When I practice Reiki and the energy flow starts, or when I practice pranic healing and the energy flow starts, there are very distinct and very clear sensations in the body. When you are giving Reiki, you can feel heat in the hands. When you are giving pranic healing, you can feel sensations on the chakras of the hands. In both cases of Reiki and pranic healing, when the flow is very voluminous, you can feel relaxation, you can feel yawning, you can feel water coming down from your eyes, you can feel your own body relaxing. So these are very distinct sensations of the flow of energy in Reiki and in pranic healing. The disclaimer is this, and it's a generic disclaimer. There is something flowing, there is something happening, no doubt about it. There are very clear, experiential, distinct, and undoubtable sensations in your body, phenomena happening in your body, and the one to whom you are giving Reiki or pranic healing, he also feels very distinct, very clear, undoubtable sensations and feelings, and often he also gets relief, whatever problem he has come with. So there is something which is happening, no doubt about it. And that something is very visceral, or rather I should say one aspect of experiencing that something is something visceral. So not only we see the effect on the problems on which you are working with Reiki and pranic healing, in the process of working, there are very distinct, clear, and unquestionable sensations and phenomena happening with both the giver and the receiver. The question is, what is it that is happening and what is it that is flowing? Obviously, whatever is happening is a result of what is flowing. So the primary question is, what is flowing? We don't know, to be honest. Something is flowing. When we practice Reiki, something is flowing. When we practice pranic healing, something is flowing. That is unquestionable. And that flow produces sensations and phenomena in our system as well as the system of the receiver. That is also unquestionable. It produces effects on the problem that somebody is brought to be solved. That also is unquestionable. The only question is, what is this primary entity which is flowing and making this phenomena happen, including the phenomena of partially or fully solving the problem. Honestly speaking, we don't know what is it that is flowing. We call it energy, but that's in an intuitive, experiential, and approximate sense, not in an empirical, specific, and exact sense. If we ask the question, heat is an energy, electricity is a form of energy, geothermal energy is a form of energy, when we say Reiki or pranic healing is flowing, that energy is flowing, do we feel anything like heat energy or electromagnetic energy or any other form of energy? The answer is no. So we cannot say it is like heat energy or electrical energy, but then you can counter question and say the experience of heat and electrical energy also is very different. There is nothing common between the two when we feel it. The feeling of touching a live wire and the feeling of touching a hot utensil are very different. So it may be that different forms of energy give you a very different sort of feeling in the human system. And that seems to be true, given empirically what we can test in terms of heat energy, electrical energy, and so on. The question is, how are we sure it is an energy? What we are sure of is it is not matter. It's definitely a non-material entity, but we don't know what it is, and therefore approximately we call it energy. Into itself, whether it is energy or a different kind of a force or a different entity that we don't know as of yet, there is no clear answer on this. We experientially, colloquially, approximately, intuitively call it energy, but this question remains to be settled in future. What exactly is it that is flowing? So with that disclaimer, I will colloquially, loosely use the word energy to say energy flows in Reiki, which is distinct from energy that is flowing in pranic healing. But we should understand that we are still actually not clear what exactly is flowing. Something is flowing which we call energy, whether it's exactly energy or some form of consciousness or some form of force or a different entity about which we don't know as yet, that future science has to settle. So with this generic disclaimer, I'll continue with this discussion of compare and contrast of Reiki and pranic healing with a colloquial supposition that energy is flowing in both the pathies. So let us get into the compare and contrast of Reiki and pranic healing. Both are forms of energy healing. Neither of the system uses any substance to heal. Both are forms of energy healing. Reiki was founded by the Reiki master Mikao Usui, and pranic healing was founded by Master Chua Kok Sui. The first difference between the two is when you practice Reiki and you practice pranic healing, there is a very different feeling. You feel as though the energy which flows in Reiki is very different from the energy which flows in pranic healing. there is a very distinct feeling. So maybe one conceptualization can be that different forms of healing energies are available in the universe, and the type of energy which we tap in Reiki, let us say we call it E1, is very different from the energy we tap in pranic healing, let us say E2. So perhaps different energies are healing energies are available in the universe, and we are tapping two different energies in Reiki and pranic healing. First difference. Second difference, in Reiki we tap only the white energy, and in pranic healing we tap many colored energies, especially after you do the part 2 of pranic, which is the advanced pranic healing. Some people modify pranic healing, and they, instead of using colored energies, they use intention. Say they do cleaning as per pranic healing, but in energizing, even in cleaning they can use intention. So instead of using colored energies, some people have innovated in pranic healing and have started using intention. So in Reiki, we use only white energy. In pranic healing, we use many colored energies. And some people who have innovated in pranic healing, they use intention. We should be clear that even while we use white energy in pranic, the pranic white energy is very different from the Reiki white energy. If we go into the qualitative aspect of energies in either of the systems, the energy that we use in Reiki is soft and it heals slowly. Energies which we use in pranic healing are strong and intense, and they heal fast. One more difference. In Reiki, the system is to do energizing. There is no cleaning stage in Reiki. So in pranic healing, you do first cleaning and then you do energizing. In Reiki, you directly do energizing. There is no cleaning phase. Some people in Reiki now mix both of them. They use the cleaning capability or the cleaning technique of pranic healing and then give Reiki. How do they work? Someone gave me a very good example, which I will share. The example was, imagine you have a bucket full of water and there is some sand in the bucket and the whole water has gone muddy. And you want the muddy water to be out of the bucket and the bucket to be filled with clean water. You have a tap from which clean water can flow. Now you have two options. Option one, you open the tap slowly and allow a drop by drop flow into the bucket. So you have opened the tap very slowly, very partially, and the flow is very slow. It is drop by drop flow, and drop by drop clean water keeps falling into the bucket full of muddy water, and after a long period of time the muddy water flows out of the bucket and the bucket is filled up with clean water. Time taken is very long and there is quite some wastage of clean water. Another approach to the same is you throw away the muddy water, clean the bucket, and then put on the tap full flow. Water wastage is less and it is done quickly. The first approach of drop by drop is the Reiki approach. And the second approach of cleaning the bucket and then filling it is the pranic healing approach. It's a very good way of using a metaphor or an analogy to explain the concept. One more difference. In Reiki, you use yantras and mantras from stage 2 and 3. So Reiki stage 1, you don't use yantra and mantra, but Reiki stage 2 and 3, you use yantras and mantras. In pranic system, you don't use any yantra or any mantra. Next difference, as a system, Reiki has 3 stages. Reiki stage 1, stage 2 and stage 3. Level 1, level 2, level 3. And level 3 is divided into 2, 3A, 3B. So when usually people say level 3, they mean 3A. 3B you learn only if you have to become a Reiki master and initiate and teach others. If you only want to practice for yourself or others, you only go till 3A. So when usually people say level 3, they mean 3A. They don't mean 3B. Very rarely somebody does 3B. So Reiki has 3 levels, level 1, level 2, level 3. And 3 is divided into 3A, 3B. Usually when we say 3, we mean 3A. In Reiki first level, you are taught how to give Reiki directly by touch. So you touch yourself and give Reiki on the main centers of your system. Or you can touch somebody who has come to you with permission, of course, and give Reiki to that person. That is level 1. From level 2, you learn how to give Reiki from a distance. You don't have to touch anybody, neither yourself nor anyone else. Without touching, you can give Reiki from a distance. The receiver does not even have to be physically present. He can be anywhere in the world and still you can give Reiki. And of course, we are in the area of mysticism. There are questions for which we don't have any answers. We are almost like in the area of mysticism and parapsychology. It is future science which will shed light on what we are experiencing as a phenomenon. So Reiki has 3 levels, level 1, level 2, level 3. Level 1, you learn Reiki by direct touch. Level 2 and level 3, you learn Reiki without touching. You can give it even from a distance. And in level 2, you are taught 2 yantras and mantras. And level 3, the third yantra and mantra. What they are, I cannot divulge. You have to go to a Reiki master for that and learn it through the official tradition or parampara. After doing 3A, if you want to become a Reiki master, you do 3B and then you can give Reiki to others. What is taught exactly in 3B is how to organize the whole program and how to do attunement, because in Reiki, attunement is very important. In all the 3 stages, all the 3 levels, attunement is important. Contrast with this, the pranic system is divided into 7 stages. The basic, advanced, level 1 is basic, level 2 is advanced, level 3 crystal, level 4 psychotherapy, or you can switch it rather. Level 3 is psychotherapy, level 4 is crystal, 5 is self-defense, 6 is arhatic preparation, and then the arhatic stages. And usually in the pranic system, attunement is not individual, and it happens in a very different way. It's almost collective attunement, and we don't even realize that attunement has happened. Whereas in Reiki, attunement is a very important part of the system, and it's done individually. Every person has to go alone to the guru for attunement. The Reiki system in that sense is a very limited healing system. It does not have any spiritual aspect to it except the generic spiritual benefits. Pranic system is a more complete system and you have very distinct stages. Pranic level 1 to Aratic prep, just before Aratic prep. So basic, advanced, psychotherapy, crystal and self-defense. These 5 are the healing part of the system. And the Aratic prep and Aratic stages, they are the spiritual parts of the system. If you are interested only in healing, not in spirituality, you can just do till level 5. If you are interested in spiritual self-development, then you go further. So in that sense, the pranic system is a more complete and elaborate system. Next difference, in Reiki, the Reiki as a system does not go into any discussion of the structural constitution of the human system or the functional aspect of the human system or what to do in certain situations. For example, if somebody is about to die, what to do about him, how to facilitate a good death, or if somebody has already died, what are the post-death ceremonies. Reiki does not go into these aspects, but pranic healing does. Pranic healing gives an explanation of the structure of the human system. Pranic healing gives guidance on death and reincarnation. Pranic healing goes elaborately into its own interpretation of many of the common sicknesses. Reiki does not do it. Next difference. In case of trying to heal or contribute to healing of a chronic sickness, often aggravation is seen, a temporary aggravation, which is common in homeopathy also, which is common in Ayurveda also, that when you try to heal something, it aggravates before it starts healing at its most fundamental roots. That is often true in psychotherapy also. ISTDP has very clearly documented that things aggravate before a fundamental healing starts, as though temporary aggravation, what is called a healing aggravation, is actually a part of the process of healing. In case of Reiki, if ever such an aggravation happens, healing aggravation happens, not necessary that it has to happen every time, but in case it happens, the intensity and duration is low. Whereas comparatively speaking, in pranic healing, the intensity and duration of aggravation is more. So in that sense, Reiki is a softer, low aggravation approach, whereas pranic is a stronger and comparatively speaking, high aggravation, not high, but strong aggravation system. It's not necessary that aggravation should happen every time. In 75% of cases, it does not happen, but in certain 25% of cases, it happens. And there is a relative difference in the intensity and duration of aggravation. Some people use a combination. I mean, those who practice Reiki use the combination. I have not seen any person in pranic healing using any Reiki technique, but I have seen quite many people practicing Reiki who use pranic healing techniques. So some of the Reiki practitioners do a combination of pranic healing and then Reiki energizing. Attunement we talked about. In Reiki, it is individual, very distinct, and done person by person, where everyone has to go individually alone to the guru for attunement, and every level the attunement is different. Level 1, there is attunement. Level 2, there is attunement. Level 3, there is attunement. In pranic healing, we don't find that kind of individual attunement. I'm sure there would be some sort of attunement done, which I don't know, but I believe it is more collective and subtle. If you have to choose, if you can, you should learn both the systems. The more you know, the more you experience, the better. But if there is some constraint and you have to learn only one system, then go for pranic healing. Can we learn from one system and improve the other, develop the other? Of course, yes. The Reiki system can easily be developed by incorporating cleaning techniques from pranic healing or from other techniques. Similarly, Reiki can also be developed using crystals, because what crystal healing essentially does is whatever input you give, that comes out in a magnified and concentrated intense form. So if the crystals can concentrate and make intense any input energy, then if Reiki energy is given in the input, the output will be a concentrated, intense, focused form of Reiki energy. If pranic energy is given as an input, output will be a concentrated, intense, focused form of pranic healing energy. So Reiki can be developed using techniques of techniques of cleaning, which can be learned from pranic healing or other forms of energy healing or other spiritual or mystical techniques. And you don't have to copy, you can take inspiration and develop, innovate. So Reiki can learn from there and develop itself. Similarly, pranic healing can also learn from certain parts of Reiki, like use of yantras and mantras. Pranic healing does not use it, but experience tells us that if we were to use yantras and mantras in pranic healing, the effectiveness can be improved. Pranic healing also does not experiment with different configurations of crystals, using crystals in series or in parallel. That also can be done. Pranic healing can also be developed by using it in conjunction with traditional psychotherapy. I'm not referring to the pranic psychotherapy, but psychotherapy as psychology defines. And pranic healing can also be improved by use of substances, psychedelics, one example of which is soma. In ISTDP and psychotherapy, intense research is going on how psychedelic substances can be used to remove resistances, fixations, traumas, bottled up affect. And the same can be done in pranic healing also. So these are the ways of developing pranic healing using yantras, mantras, configurations of crystals. At present, they are using crystals, but not configurations of crystals. Using pranic healing in conjunction with psychotherapy, in conjunction with psychedelics. So this is the way both of them can be developed, partly learning from each other, partly learning from other systems of healing. Question in your mind can be, if you are a seeker of healing, what should I go for, Reiki or pranic healing? Simple answer is there is no standard answer. You should go for what works for you. Experience both of them. Experience Reiki for 3 months, experience pranic healing for 3 months, and whatever you feel more comfortable with, whatever gives you better results, go for that. So what works for you is right for you. Can you go for a combination? In general, no. Because if you go for a combination, it will be difficult to make out what works and what doesn't work. So go exclusively first for 3 months Reiki, 3 months pranic healing. then make a choice. If in exceptional situation you feel that you need both, nothing wrong in going for it, whatever works for you. If Reiki works, fine. If Pranic works, fine. If neither works independently, but they both work only in combination, go for a combination. You can differentiate the timings. So if the Reiki healer is giving you Reiki in the morning, ask the Pranic healer to do it in the evening. Or shift the days, alternate days go for, or go 3 days each. 3 days Reiki, 3 days Pranic healing, whatever combination works. If your body is very sensitive and if aggravation is a problem, that whenever you try any healing system, aggravation is very high, then start with Reiki. And only after considerable healing has been done by Reiki, go for Pranic healing if necessary. If not necessary, don't have to go there. Can Reiki or Pranic healing heal something which is traditionally thought of to be incurable? Can it heal it at its roots? My experience has been of limited outcomes when it comes to chronic sicknesses. So if you talk of diabetes, asthma, blood pressure, Reiki and Pranic healing are very good in controlling it, in not allowing it to become worse, but usually they are not able to heal it at the roots. And they become complementing medicines, not the main medicines. So if you have, like I have asthmatic problem, I cannot live only on Reiki or Pranic healing. I have to take allopathic medicines, and Reiki and Pranic healing I use to not allow situation to get worse and reduce my dosage so that I have less side effects. So do they complement, do they contribute to control? Yes. Do they heal at the roots? No. Why no? Because it is a force field. There is a force of sickness and a force of health. And if you have a chronic or a incurable disease, the disease is very strong. Now to cure that disease, you require a very strong Pranic healer or a Reiki healer. So energy healing is something where the power of the healer is very important. It is not a substance-based medication like we find in Ayurveda or allopathy. It's not that you give a 500 mg tablet and the tablet works. It does not matter who gave you the tablet. In case of energy healing, especially Reiki and Pranic healing, the how powerful the healer is a very important determining factor in how deep he can heal. So there are very few Pranic healers or Reiki healers who are so powerful that they can heal something which is thought of as incurable. But they are very few people, and they don't do it because they are afraid of the karmic load that will come onto them, because it is believed in these systems that the chronic sicknesses, apart from many other factors, also have a karmic contribution. So it is not that these systems negate science, empirical science or empirical findings or allopathy or anything of that sort, or biology. But they do believe that in addition to all the scientific things which are true, there also is an element of karma at work. And if you heal somebody using Reiki or Pranic healing, in opposition to the karmic load, then you have to bear the consequences for interfering in somebody else's karmic situation. And what he had to suffer, now you have to suffer. So out of these considerations also, those who are powerful healers, they don't get into healing at the roots of difficult situations. So then what do you do if you are in a difficult situation? Like I am in one. First is you take advice and medication from a good doctor. In allopathy, you cannot risk not going to allopathy. And then you complement it by using naturopathy, psychotherapy, pranic healing or Reiki, homeopathy, or going in for emotional detoxification, group meditations, or group workshops like AUM meditation, or emotion centered group workshops, or ISTDP, or EDT's types of group workshops. You can do those things. So this has been a broad compare and contrast between Reiki and pranic healing. If you have any questions, you can write to me. Every system has its own strengths and limitations. Unfortunately, practitioners of any system are hijacked by the unconscious quest for omnipotence and partly by their self-interest. And usually they are not honest enough to tell us what are the strengths and weaknesses of the system. So like all systems, Reiki and pranic healing also have their own strengths and weaknesses, and they are complementing systems. They are not substitutes for allopathy. Thank you.